There are 5 scientifically proven exercises that instantly reduce knee arthritis pain, even if it's bone on bone. As a physiotherapist for 20 years, I've helped hundreds of people over 60 reduce their pain, rebuild strength, and move with ease, all without medications or surgery. So in this video, I'm going to show you the exact 5 exercises that have helped one of my patients prevent a knee replacement, climb stairs with ease, and return to tennis all within a matter of weeks. Before I show you these exercises, let me tell you about one of my patients, Jane. She was 66 when her knee pain started creeping in, stopping her from playing tennis. She tried everything: rest, painkillers, stretching, even physiotherapy, but nothing seemed to help. Her doctor told her it was just wear and tear and that a knee replacement was her only option. But instead of accepting surgery, she came to see me, where we took a completely different approach. Now, one of Jane's biggest frustrations was simply lifting a leg like stepping into a car or up onto a curb. I immediately recognised that this was a clear sign of weakness in her hip flexors and quadriceps. These are the muscles at the front of her hip. This weakness is common for people dealing with knee arthritis. So one of our first priorities was to strengthen her quadriceps. And we had good reason, as a 2021 study showed that strengthening the quadriceps can improve knee pain and mobility in just 6 weeks. So that's where our first exercise comes in. Sit on a bed or a flat surface with your legs straight out in front of you. Make sure you're comfortable and your back is supported. Pillows behind you is totally fine. Now take a rolled up towel and place it under one knee. Your leg should still be straight. The towel just gives your knee a little lift. From here, I want you to press your knee down into the towel. This is how you engage your quad, which is that big thigh muscle. Imagine you're trying to flatten the towel underneath your leg. You might notice your foot lift off the bed slightly. That's completely fine. Hold that squeeze for about 10 seconds. Really focus on that tight, active feeling in your thigh. Then slowly relax your leg and return to the starting position. That's 1 rep. Try doing 10 reps on each leg and aim for this 2 to 3 times a day if you can. It's a great way to build strength without putting stress on the joint. If this exercise starts to feel too easy, there's a simple way to make it a bit more challenging. Start in the same position with your legs straight and quads engaged. Try gently lifting your leg a few inches off the bed, then lower it back down nice and slowly. Do this about 10 times, keeping the movement smooth and controlled. You'll still be working your quadriceps, but with a little extra effort, and it's perfect for when you're ready to progress. Now, if your knees are really sore, try using a larger, softer towel under your knee. That extra support makes the movement gentler, but you'll still get all the muscle activation. If your knees do hurt, you might be wondering, is it safe to exercise a joint that already hurts? It's one of the most common questions I get, and it's a really valid one. The short answer is yes. In fact, it's not just safe, it's essential. According to the latest 2024 clinical guidelines on knee osteoarthritis, some discomfort during exercise is completely normal, especially when you're starting out. That little ache doesn't mean you're causing damage. It usually means your muscles and joints are waking back up and are starting to get stronger. The way I often explain it to my patients is like this. Think of your joints like a stiff door hinge. If you don't move it for a long time, it creaks, resists, and feels stuck. But the more gently and consistently you move it, the smoother and quieter it gets. But on its own, this exercise wouldn't have been enough for Jane or for you, because while she could now lift her leg, she still found herself getting tired quickly when walking any real distance. And that's because it's not just the muscles on the front of your leg that matters. You also need strength through the back of your legs, especially your glutes and hamstrings. So let me show you how you do that so you can get rid of this knee pain for good. Start by lying down on a stable surface like a mat or soft carpet with a pillow or towel under your head for comfort. If getting down on the floor is challenging, feel free to use a bed. Bend your knees and plant your feet flat on the floor. Angle your elbows out and press them into the ground. This will give you some stability. From here, tighten your core muscles. Then press through your heels, squeezing your glutes to lift your hips up as far as you can, aiming to create a straight line from your shoulders to your knees. If you can't go that high, lift to your best range. Hold this position for a count of 5, keeping your glutes controlled throughout. Slowly lower your hips back to the floor, gradually releasing the squeeze. That's 1 rep. This is the classic glute bridge. If you're feeling this more in your quads than your glutes, try moving your feet a bit further away from you. On the flip side, if your hamstrings are doing all the work, bring those feet a little closer. To make your glute bridge more challenging, try the single leg variation. Lift one leg while performing the bridge. This version adds intensity and engages the stabilizer muscles in the side glutes even more. This will also highlight any strength imbalances in your glutes. I suggest you aim for 15 to 20 reps for 2 to 3 sets with 90 seconds rest between sets, aiming for 3 to 4 times per week. Now that walking had become easier for Jane, she still struggled to get out of her chair. That's because walking and standing use your muscles in very different ways. And standing up, especially from a low or soft chair, takes a combination of quad and glute strength, balance and coordination. So this next exercise became a key part of Jane's routine, and it's one I recommend to nearly every patient over 50. It helps you build the exact strength and control you need for real life movements, like getting out of a chair or out of a car, or even getting off the toilet without needing help. To start, sit on a stable chair with your feet roughly shoulder width apart. Scoot forward so you're sitting at the edge of the chair, then move your feet slightly backwards so they're positioned just behind your knees. You have two options here. If you feel stable, hold your arms straight out in front of you. If balance is a challenge, use the armrest or the seat of the chair for support as you push off. From this position, straighten your legs as you push up into a standing position. A lot of people make the mistake here of using momentum, but you want to instead focus on slow and steady movements so you really engage those muscles. Once you're standing, make sure the chair is behind you. Reach back for the armrest if needed and slowly lower yourself back down into the seated position. This exercise is called the slow sit to stand. For best results, rise up quickly to build power, but lower yourself slowly to build muscle mass and strength. Aim for a count of 4 to 5 seconds. Here, you're working against gravity to lower you with control. Also, try to keep your knees aligned with your toes. That way, you will activate your glutes a lot more. If you're losing your balance when getting in and out of a chair and have to rely on your hands for support, there's a simple technique to make this easier, and you can also use this technique when going up the stairs. As you start the movement, bring your head forwards. It's called the nose over toes method. So by bringing your nose over your toes, you move your body weight forwards. This makes it easier to stand up by pushing through your heels. When sitting down, you simply reverse the movement, bring your nose over your toes, stick your bottom out, and lower yourself slowly back into the chair. Standing at once and sitting back down counts as one rep. Aim for 15 to 20 reps for 2 to 3 sets with 90 seconds rest in between. And repeat this 3 to 4 times per week for maximum benefit. If you can't do that many reps or sets right away, go for as many as you can, but make sure your muscles feel tired. The last few reps need to be challenging for the muscles to grow. Then try doing a little bit more every session, either by adding some reps or doing an extra set. Think of it like running a marathon, not a sprint. By focusing on small, consistent improvements, you'll keep making progress, leading to big, lasting changes. Now, if Jane had only done these 3 exercises, she would have been getting out of her chair without much issue. But there was still one big challenge holding her back, and that was the stairs. She told me she dreaded going up and down them, even avoided certain shops and places because of it. That's why this next exercise became such a key part of a routine. So for the next exercise, use a small step or the bottom stair at home. Hold it onto a railing, chair, or countertop for support if needed. Start by placing one foot firmly on the step, facing straight ahead. Push through the foot on the step to lift yourself up. Reverse the movement slowly and lower yourself back down with control. This is called a forward step up. If this feels too easy, drive your opposite knee forward and up. To make it even more challenging, hold some kind of weight like a dumbbell in the hand opposite to the leg on the step. This makes your glutes work harder to keep your body stable as you step up and down. Aim for 15 to 20 reps for 2 to 3 sets with 90 seconds rest between sets. And repeat 3 to 4 times per week for maximum benefit. Make sure you focus on keeping your pelvis level as you move up and down, and make sure your knee stays aligned with your foot or even with your pinky toe to avoid strain or injury in your knees. Move back down slowly to maximize the muscle activation. You'll know you're doing it right when you feel the burn in the glute of the standing leg by the end of your set. By doing these exercises, climbing stairs will be easier, safer, and much more efficient in just a few weeks. This last exercise is what gave her the strength and control to stop suddenly on the core, change direction, and push off confidently without hesitation. But for you, this could be crucial for everyday movements like getting down to the floor, reaching into a low cupboard, or picking something up without straining your knees or back. You could do it with or without weights, but we'll start with just your body weight to make sure you've got the form right and that your knees feel supported throughout the movement. Start with your feet shoulder width apart and hold onto a chair or counter for support. Keeping your back straight, take a larger than usual step backwards. As you step back, your front leg should form a right angle at the knee, while your back leg stays on its toe and bends at a right angle. Lower yourself smoothly by bending both hips and knees, keeping your back in a straight line from your neck to your lower back. Your knee doesn't need to touch the floor. Aim to stop about 3 to 5 centimeters above the ground. Once at the bottom, rise slowly and smoothly, keeping your abdominal muscles engaged, and remember to breathe. Return to the starting position and repeat the movement on the other side. Now, there are some common mistakes to watch out for. Stepping too far back, not stepping back far enough, or letting your body collapse inwards. To help with this, imagine your chest is tied to the ceiling by a string, keeping it lifted as you move to maintain good posture and control throughout the exercise. This is called a reverse lunge. Lunges are a fantastic way to improve strength, balance and joint health, making it a must-have in any exercise routine. As you build strength, gradually increase the depth of your lunge and the number of repetitions. And if you find this too easy, let go of the support. And to make it even more challenging, you could hold 5 kilo dumbbells in each hand for added resistance. Aim for 15 to 20 reps for 2 to 3 sets and repeat 3 to 4 times per week for maximum benefit. One final tip is to wear proper shoes when doing this exercise. Trainers with good cushioning are best, as they'll help protect your feet and knees, especially if you're on a hard surface. Remember, the reverse lunge isn't suitable for everybody, so if you're unsure, check with your healthcare provider first. But for most people, this exercise performed a few times a week will build strength and improve balance. Now, you might be wondering, why are we stepping backwards? I don't do this in tennis. That's a great question. And the reason we have this movement is because it's one of the safest and most effective ways to build the kind of strength and control you need for tennis, like pushing off the ground, stopping suddenly, and lunging to reach for a shot. I gave this to Jane because it helped her rebuild hip and knee stability, improve her balance, and strengthen the exact muscles she needed to feel confident on the court again without flaring up her arthritis. So, while it may not look like tennis, it's exactly what prepared her for it. If you're worried doing these exercises will be too painful or make things worse, don't worry. There's a way to make sure your body can handle it without exacerbating the issues, so long as you're giving it what it needs. So in this video, I go over 2 supplements that make all the difference and why you should ignore all the other ones that are being sold to you.